you have to be uninsured for 6 months with no coverage whatsoever as a requirement to be eligible for the high-risk pool. So this is not just for anyone. It's really for people that have not been able to get coverage and have indeed not been covered for medical insurance, and now they have this portal, but it's also quite expensive.
So these are people that have probably some chronic conditions that haven't been able to get coverage, and yet they've got to be without coverage for 6 months in order to qualify. They still have to pay a premium, though.
Absolutely.
So what this is doing is guaranteeing them access to coverage, not necessarily granting them coverage. They still have to be able to pay for it.
That's correct.
Okay.
The next area is a consumer information portal, which is now available. You'll see the website, www.healthcare.gov. That is where consumers can get information on federal programs and private health insurance as well. So there's all kinds of access to the consumer for all different types of medical coverage. And that includes your Medicaid subsidized programs, your child health insurance plans. In Florida, we have the Healthy Kids program and Kids Care that are subsidized programs for lower income employees. So this is where they would be able to access that information.
And Dave, I unfortunately have lost the connection to the server.
Uh-oh. Well, I want to let you know as well that under the new guidelines for healthcare reform, there's a new notice that employers are required to provide to their employees that are covered under a health plan.
We're back in service.
Okay. That started back in May. So as your plan renews, you need to be providing a CHIP notice to all of your employees. And basically what this does is it informs them that there are subsidized programs available through the state that may be available for dependents at a lower cost than is available through their health plan.
So this is for an individual, on an individual basis?
This is a group requirement for all employers that provide benefits, and yes, they would be able to access these programs typically on an individual basis for dependents.
Okay.
But that's something I'm surprised there are employers that are not aware of this, and this is a federal requirement for all groups and should be provided to your enrolled employees prior to your renewal date. So typically it's going to be during your open enrollment as part of that process.
Okay.
I want to talk about grandfathered plans because it's interesting that when the healthcare reform was passed, all of us heard that there was not going to be any changes required of people that were satisfied with their group health insurance. They were going to be able to keep everything exactly as it was. Well, after the bill passed, and especially with the reconciliation bill that kind of changed a lot when it comes to the grandfathered provision, that a lot of those things were stripped. So it really is very difficult for a plan to maintain the same coverages that they had prior to the act. They got to meet a lot of requirements. As employers prepare for their medical insurance renewals taking place after September 23rd, they'll need to determine the potential value of that grandfathered status. So what we're going to do next is we're going to look at what provisions an employer would not have to meet if they maintain the grandfathered status.
Okay. So grandfathering could be a good thing for some companies, but there may be some reasons why they don't want to grandfather their current plan in and want to look at some new coverages or added some new coverages or things like that?
Yes, exactly. Basically, you have to keep your current plan pretty much intact. There's some provisions of changing co-pays no more than $5. You cannot change the co-insurance percentage where the employees have more risk or more expense, or else you forfeit the grandfather status. Originally, you could not even change a carrier, but as of November 17th, and this is something brand new, another change, if you change your carrier and you maintain basically the same or very similar coverage that aligns with the requirements, then you will be able to maintain the grandfather status.
Okay. So let's look at some of these provisions as to what you have to be grandfathered, and what would happen if you didn't adhere to the grandfather status, and so you had to change. And what that will do to impact your coverages.
That's great. There are 5 provisions that are not required if your plan has the grandfathered status. Now, I do want to say, too, if you do believe that your plan is grandfathered, there is a reporting notice that you have to give your employees stating that, in your opinion, as the employer, that your plan does meet the grandfathering criteria. Now, the first of those 5 provisions that, as a grandfathered plan, you do not have to meet regards discrimination. Under the health care reform, you're really not able to discriminate with regards to eligibility or benefits between your higher compensated employees and all other employees. So there are many employers in the past, Gina, and you're probably aware of this, that they pay maybe 100% of the premium for their board officers or owners for their whole families, but yet they only pay a portion of the employee-only premium for the rest of the staff. Or they may have a different eligibility criteria. For their upper-level management, you may get coverage the first day or the first of the month after you become an employee,
right,
whereas other employees may have a 90-day waiting period. If you don't provide the same thing across the board under health care reform, then you're going to be non-compliant.
So this kind of levels the playing field.
It totally levels the playing field, and but if you maintain your grandfather status, you can still continue to discriminate between employees for eligibility and for benefits. So the question to me was, well, what kind of penalties is there for non-compliance? That's a pretty good question. The next area deals with preventive mandates. For grandfathered groups, they do not have to offer preventive services at 100% without co-pays or co-insurance or deductibles applying. Now, this really is a moot point because most of the carriers have said we're going to provide preventive services across the board, whether you're grandfathered or not. But that's one of the provisions that would have been exempted.
And this kind of goes back to the old HMO days when they came into being to be a good preventative measure, so that with the thinking being, you know, we can catch things on the front end and prevent illnesses or healthcare situations, then perhaps we can treat conditions at a less expensive rate. And HMOs kind of sold that as a bill of goods, and it's really a good plan. It makes a lot of sense. Through the years, we kind of got away from that, but now they're trying to bring that whole thought process back.
You're exactly right, Gina. Why not catch something early, treat it, and then you don't have the massive expenses and the pain and suffering later on. So this is good.
Yeah, and really what you're doing with that is you're building good health care practices as an individual. You know, go in every year and get your checkups, make sure that you get all your immunizations, make sure you get your, health screenings when you become eligible, and hopefully we're building some good practices so that we can prevent things from happening, or if they do occur, we can catch them sooner than later.
Absolutely.